The next study is looking now not at pancreatic cancer patients, but now looking at advanced biliary tract cancer patients. This is a population, it's not a common tumor, first of all. It's less common than pancreatic cancer, and it has the problem is the bile ducts are intimate within the liver, and it's a very complicated surgery if this were to occur, so if it was a curative approach. The problem is it usually hides in the bile duct walls, and it usually is advanced. And so metastatic biliary duct tumors, now we're understanding a lot more about them, and there seems to be about 17 different types of biliary duct tumors. Some of them are extremely sensitive to therapy, and some of them are extremely resistant to therapy. But that being said, we don't have genomic profiling. We have, genomic profiling, but it's not it's more research-based. That being said, the prognosis for advanced biliary duct tumors is quite poor. These patients don't live longer than a year, typically with chemotherapy, and the chemotherapy standard of care currently still gemcitabine cisplatin, but now new data is coming that it can be gemcitabine capecitabine, so GemCap being quite effective. This study is now showing that we know that Niliri, so liposomal or Lipiri, liposomal irinotecan, sounds like it's a Botox injection. Lipiri is quite effective in GI tumors. We've seen it effective in pancreatic cancer. There's signaled gastric cancer, which, by the way, I treat a lot of. There's also going to be signal in colorectal. So most GI tumors are going to have an effect with Niliri, thereby biliary duct tumors will probably have an effect. So this study, it is called NIFE, N-I-F-E. This trial is looking at the effect of Niliri combined with 5-FU versus gemcitabine cisplatin. It's a phase 2 randomized trial with the main primary endpoint being a progression-free survival at 4 months. And it's a good cutoff at 4 months because typically half of your patients will still probably be alive at 4 months. So it is just a trial design right now, and it looks like they're going to be starting to accrue January of next year. So it's kind of just, a clinical trial in progress. The interesting part here, though, is that they're going to be looking at, once again, assessing some tissue. So they're going to be looking at circulating tumor DNA and whether or not we're going to be able to obtain more data and more information on these biliary duct tumors. And looking at whether or not Niliri has maybe a different effect on the circulating tumor DNA than gemcitabine cisplatin. So I think it's going to be an interesting trial. It's if it does become positive and Niliri is more effective than Gemcis, it may have the opportunity of changing the treatment regimen for this rare tumor. Yeah, so I think, we'll see in terms of, so it's going to address, it's a good point. Thank you, Alice. That's Dr. Alice Way, by the way, you're going to be hearing from in 2 minutes. There's also going to be probably for sure different, the safety, efficacy, and tolerability of the treatments. So Gemcis is very well tolerated. It's not that toxic. There might be a little bit of nausea, very little peripheral neuropathy, but it can occur. And nephrotoxicity is not that big because we're using low dose cisplatin. That being said, Niliri, now Niliri here in this trial, by the way, is the liposomal irinotecan is less. It's 80 milligrams per meter squared compared to 120 milligrams per meter squared, as was in Napoli. So in the pancreatic, it's a higher liposomal irinotecan dose. But that being said, we'll see about safety, efficacy, everything. It's going to give us more information in terms of this combination in this patient population.